I think there's lots of ways to get services wrong for supporting people with co-occurring mental health and substance use. But there's several right ways as well, and I think the skills and experience we've come across in the room has been really good. So in Manchester we've got a really small service. We'd love to do a lot more. I've been able to take some ideas and ways that I can embed those into our practice, but hopefully it's coming together has been a nice way to be able to share some of the things we do. So we've talked about motivational interviewing and its approaches to support people with co-occurring needs, and trying to remove that sense that you have to be an expert. I think, you know, when you're working with someone with co-occurring mental health, alcohol and drugs, you've got an expert right in front of you. You don't need to be the expert with the power and the control, and you just need to understand and listen and learn, because people have that unique perspective, and I think there's a lot of value in trying to draw that from that individual. The challenge with services is then putting support around that. And I think that's where it gets really complicated. And there's a lot of hope there today that recommendations, plans can be put in place to think that it's not the people we work with that are complex, it's the services that we've got are complex. And we need to work on that complexity as opposed to thinking that the people we support are unfathomable or too complicated or complex. So it's been a really good day for that. And one of the things we try and do in Manchester as well as part of the network, we have a Room 101 discussion. So it's an opportunity for staff who work with this group of individuals to come along and share the language that they hear from their colleagues that really annoys them. So we hear things like, and then we have a discussion about it. We come up with 2 or 3 nominations, and then we vote, and one of them goes into Room 101. So this year we've had things like non-compliant, well, you know, really challenging some of these stigmatizing terms that someone's not compliant with what we suggest for them.
Difficult to treat, hard to reach.
Yeah. Care-seeking behaviour, or don't collude, or I don't know, I'd have to go and get the list. But
yeah, I can imagine that's quite a kind of cathartic experience for a team at the end of a tough week.
It's the end of a Monday afternoon, but what we spend a little bit of time just at the end is, then what do we do with this? We can all sit around and moan about the terms we use and the underlying message underneath them, but really, how do we then challenge that? How do we support our colleagues and our peers in a non-adversarial way, in a supportive way, by just asking those simple questions? What do you mean by that? What do you mean when they're not compliant? Help me understand what you mean by that. And then say, oh, perhaps it's that they're not compliant, it's just they don't feel medication works for them. And just trying to reframe it for colleagues.